This morning, we're learning more about the treatment and the medicine the president is getting following his COVID diagnosis.
And Dr. Raj of Keck School of Medicine of USC joins us live this morning. Dr. Raj, good to see you, and thanks a lot for being with us.
Good morning.
Hey, good to see you, DeMarco and Suzanne. I missed you guys. I haven't seen you in a while.
Yeah, we missed you as well. Let's go ahead and talk about the treatments that the president is receiving.
Sure.
So we mentioned remdesivir. There's also other drugs that we learned about this weekend.
Sure, no problem. So when we talk about the medications, we'll talk about remdesivir first. So this is a medication that we usually get the patients who have, moderate to severe disease. And when we talk about what is the president's, overall health status, it is kind of confusing because of the fact that there's been a picture that was painted that everything is going well, we're going in the right directions. And this is usually a drug that we talk about people who have low oxygen levels. We're giving these monoclonal antibodies out there that are going to be medications that we give in individuals who are probably to boost their immune system, not to mention this drug called dexamethasone. It's a steroid. And we've used this medication in patients who have severe disease in the medical ICU or are on the ventilator who require lots of oxygen. Sure, it has some survival benefit, but there definitely is going to be that disconnect between the medications we are giving the individual versus the picture that we are painted that he's doing well and possibly going home soon. Usually those two things are on opposite sides of the spectrum.
So, Dr. Raj, would they give it to him? It's like giving something strong to prevent it from getting worse? Or what do you think of this?
So there's different schools of thought. One school of thought is they're being very, very proactive. Like, here are these medications, here's steroids or remdesivir, and let's just give it. The other school of thought is that we're not really having the insight into the severity of disease. And as you can tell by watching all these press conferences and news conferences, it is like you almost have to play detective. What is the information that you really need to know? Because what is the oxygen? Is it low? Is it not? When was the last negative test? There's so many questions you know to give an accurate opinion of what's going on. But the other hand is, maybe it is severe. I remember yesterday I heard that there was a chest x-ray or a CT and there were findings that were expected. And everyone's saying, well, what do you expect? And if you hear combinations like low oxygens, fevers, and something on an imaging of your chest, you wonder if is it more severe than we are brought out to let us know.
So, Dr. Raj, why did the reporters ask if he was getting steroids?
I thought the reporters did such a great job in asking really medical questions. I bet there were a bunch of medical students in the audience, So the steroids were asked early in the press conference to wonder, hey, because there's a question about his oxygenation, was it low or not, that if you give this to individuals, it may help them out in severe cases. You don't want to give the steroids to people with just mild disease because you can have more of the side effects and less of the benefits. So that was a really great question. They were asking a lot about oxygen levels because it is important. And as we found out, the oxygens did drop, multiple times during his course. And of course, one thing about COVID-19, it always is a humbling virus, but we do know that you could look great on the outside and your oxygens can be very low on the inside. So all these questions were appropriate and well asked.
So the president, we're hearing, could go home today. Is this too soon? Can't the COVID, it usually takes 10 days possibly at times to show itself.
Suzanne, this goes back to the timeline, right? Everyone is asking the questions. When was the last test? When did you get symptoms? Because of the fact that when you usually test positive, it's the next day, because of the fact that there is that kind of incubation period that happens 5 to 6 days. And it almost seems like he was positive and wow, there's fevers and there's a drop in the oxygen saturation. So the answer is yes, we don't really know the timeline, but it seems odd that you would give steroids, you'd give IV remdesivir, maybe it's up to his 3rd or 4th dose right now, then the next day you're going home. It kind of caught me for a surprise, just as when he went for his public appearance, that kind of surprised me too.
So he's not out of the clear just yet.
I think you have to be humble, and I think that to give a date, to predict when something's going to happen. I'm a critical care doctor, and when I look at my patients, I don't think day by day, I think minute by minute, I think hour by hour, because that's what I do as a critical care doctor, especially with COVID-19, where they're throwing you curveballs all the time. So I don't want to predict anything, especially because of the fact that there's always been a change in the information that were presented to us.
All right, it's such a serious story, so I didn't want to do it off the top. But Dr. Raj, it's so good to see you, man. We missed you so much.
We did.
We've been talking about you for like a while now, haven't we?
Yeah, of course, because we feel like you really put it into every man's terms instead of just doctor
Yeah, you break
terms.
it down for us.
Thank you.
Yeah, I was trying to
We'll
think of
get
a
to see
nice
each
way
other
to say
soon.
it. Yes.
All right, take care, man. Take care. Always good to see you.
Yes.